Doctors of Reddit, what home remedy has a patient try that backfired in the worst way possible? Found a cavity in the little girl's tooth, and rather than have it filled, Mom tried to heal her kid's cavity with oil pulling. Kid came back for her 6-month checkup and Mom expected me to see the cavity was healed because it had stopped hurting. She told the hygienist not to tell me because she wanted me to be surprised when I saw it. The cavity had grown so large the tooth needed to be pulled. Massive giant hole in it with tons of decay. You don't have to be a dentist to understand you were looking at a massive cavity. It had stopped hurting because the nerve had eventually died and was causing an asymptomatic infection. Poor kid. Tooth whitening with bleach baking soda mix. Repeatedly. Teeth were white and chalky, and you could crumble them with fingers. We had an elderly patient trying the Epley maneuver at home to relieve her BPPV, vertigo caused by crystals in the inner ear. The maneuver includes sitting on a bed and throwing yourself back onto your pillow. Harmless, unless you hit the wall behind you. She suffered a subdural hematoma and had to get her skull drilled and sawed open to relieve the pressure. She died during post-operative care. Dentist here. Patient had a ceramic crown fall off their tooth. Instead of coming in to see me to re-cement it, which is very easy to do, they used super glue themselves. Don't do that, please. The body does not like super glue. My husband had a guy who came in with vague neurological symptoms. Turns out he was ingesting borax to increase his boron levels. Edited to add. Husband said the guy thought it would help his arthritis. PT stepped on a nail, and, instead of just pulling it out, he decided that he should just put his foot in milk. 4. Reasons? Pro tip. Don't do that unless you want a serious infection. Bonus. Different PT with another puncture wound in their foot decided to put their foot in Listerine. At least he didn't have to worry much about an infection from doing so. But that had to hurt. Had a patient doing urine therapy, which involved putting her own urine in her eyes. Came into the ER with severe conjunctivitis. I don't often have to consult ophthalmology, but I was genuinely concerned she'd permanently lose her vision. Your body gets rid of urine for a reason, people. Leave it out of your body where it belongs. I remember a guy who came to the ER for a painful ear infection and his ear was a real mess. When I asked him what exactly he had done to treat it, he told me that first he stuck some minced garlic, then he poured alcohol into it, and then he shoved a cigarette, which, obviously, didn't get very far, but still managed to burn him quite a bit. One guy thought if he applied some dirt on the wound it would suffocate the bacteria and wouldn't get infected. Patient came into the ED for basically necrotic toes. She said she tried soaking it in bleach a few times a day and it just kept getting worse. We had a patient in our UC who was having lower back pain, so he put ice on it. He said it felt so good and he hadn't slept in a few days due to the pain, and he fell asleep with the ice pack on his bare skin. He woke up with the ice pack stuck to his skin and came into the office. He had second-degree burns and the blistered skin was peeled cut off with the ice pack. I'm a genetic counselor and not a doctor, but was meeting with a patient about genetic testing related to her triple-negative breast cancer, often an aggressive form and more likely to be due to mutation in the BRCA1 gene. She had brought a friend along to the appointment. As I remember, the appointment generally was pretty normal. At the end, I'm filling out some paperwork. Patient goes to the restroom and friend stays in the room chatting. Suddenly she says, "I'm just so proud of her for how she's handling all of this. She did all of this research and found online a way to treat her cancer with vitamins and herbs. It's been so good for her." It took everything in me not to tell her off. But hey, I'm not a doctor and it's not my place, plus wouldn't have done any good anyway. When the patient came back, I said something about please talk to your doctor about all medications and treatments you're pursuing. This type of cancer is not something to mess around with, but I can't say much more, because I'm not a doctor and not an oncologist. Relatively minor thing I did once, but got a lecture from the ER doc about. I was camping and a bug flew in my ear and died. I thought I got it out with the arm of my sunglasses. I honestly completely forgot about it until like a week later when my ear was totally infected and swollen. The ER doc was like, "Next time just come see us." I'm not a doctor. I did, however, have a child with leukemia. My crackpot sister-in-law had recently jumped on the Juice Plus bandwagon. She insisted I give it to my kid, because it cures MS. 1. Not the same thing. 2. No, it doesn't. I tried to be polite and asked if it had vitamin C and grapefruit juice in it. 2 things she currently couldn't have because of her chemo. She said it did. I told her that she couldn't have it. She kept pushing me to just ask her oncologist. I told her I didn't need to and gave her the reason. Her solution? Obviously we needed to stop chemo. Needless to say, she wasn't allowed alone with my kid after that. Former EMT and not a doctor, but one time had a patient who decided to cool her fever by dousing herself and rubbing alcohol. She then decided she needed a cigarette. We got to take her to the hospital for burns after her clothes caught on fire. I'm a physical therapist. A lot of my patients joke about needing WD-40 for their creaky and arthritic joints. Had another patient make this joke a few years ago. I politely laughed. He then leaned in real close and said, but sometimes I really spray some WD-40 on my knee and rub it in, and it helps. Placebo is a wonderful thing. My sister is a nurse and apparently putting garlic in your VJ doesn't get rid of bladder infections, but apparently a lot of women try it. She's had 7 in the last 4 years. I had a patient in clinic with a large breast mass. We asked how long ago she'd noticed it. She'd known it was there for about a year, but was using anointed olive oil and prayers as treatment. The cancer was advanced by the time she came in. ER doctor here. So many stories. Had a young guy who got a peanuts fracture from his girl riding cowgirl style, and he decided to just put an ace wrap on it. He was so worried what he'd see he left the ace wrap on for a few weeks before he came to the hospital, because it started leaking pus. When I took it off I could hardly make out the anatomy, it was so distorted, but he had an open hole into the corpus cavernosa. Urology took him to the OR. I doctor here. Right at the start of Ovid, I had a patient come in with blurred vision and I start examining him. Mid-20s guy, whole life ahead of him. I can't get his vision better in any way I try, so I start looking at his eyes, and looking at his retinas. Something is severely damaged. He has 2 burn holes in his retinas. Have you been sun gazing? Apparently, he read somewhere that vitamin D was good for resisting Ovid, which you can get from sunlight exposure to the skin to promote natural synthesis, so he thought he would collect as much sunlight as he could with his eyes. He has solar retinopathy now and permanently reduced vision with no chance at improvement after burning holes in his maculas. I'm not a doctor, but my overweight uncle started smoking to lower his heart rate. He had a heart attack. ED nurse here. I once had a patient come in aching at a crisis. They couldn't move except to talk, and even that was difficult. They were sweaty and really warm as well. What happened was that they had Parkinson's disease, had it for a while by then, but they'd been convinced by a friend to stop taking their meds and visit a Christian faith healer. They were convinced that their Parkinson's had been cured and that their symptoms were caused by their body getting rid of the Parkinson's toxins. One very long conversation with neurology later. We got them started on a couple of medication patches and admitted to the ward, but that was a super depressing presentation. Not a doctor, was in a small town ER. The ones where there's just a bunch of sheet thingies hanging from the ceiling to separate the beds, and the guy in the next bed had tried to remove a tattoo by heating up a spatula and burning it off. Kind of the opposite. I had jock itch that wouldn't go away, and anything I tried would subside it and it would come back later. I talked to my PC and he told me to use a little bleach and water and spray it on myself. I didn't do that and instead saw a specialist, who told me it wasn't jock itch, but psoriasis, and would have gotten 10 times worse if sprayed with bleach. I was listening to How Stuff Works and this guy decided to ingest colloidal silver for over 10 years to cure a skin problem, and it ended up turning all of his skin blue, and it's irreversible. Colloidal silver is antimicrobial and being pimped by celebs such as Gwyneth Paltrow and Dr. Oz, but too much is bad. Unless you want to audition for the Blue Man Group. Not a doctor, but there was a story here in Argentina about a guy that had a horrible back pain. His solution? Injecting his arm with his own semen. He went like that for about 1 or 2 years. Then doctors had to cut some parts of his arm, because it was wasted. This isn't one guy. kind of like a repeating thing every now and then. Sometimes people get cancer and, for whatever reason, fear/not wanting to accept life etc., they go about with these nonsense therapies. Eventually they start getting really sick. The lucky one have time and can try actual treatment, but it's already happened to me, in only a semi-short time, that people sort of miss the window and the cancer is more or less terminal or at least really out of control. And to a bit of a tangent, but similar, a lot of people also treat their body like crap for years. Then when they are old, they might need something that is fairly severe, usually surgery, but it can be something else like intense physical therapy, but they are just too out of shape and beat up that they can't handle it and all they can do is start an accelerated spiral down. I am not a doctor, but I was a first-hand witness to this whole episode. A family member had sudden onset back pain, severe back pain. So what did they do? Why? Go to the chiropractor, of course. They started going to the chiropractor once a week to fix the pain. This went on for about a year. Then they woke up being completely unable to move their back without excruciating pain. We call an ambulance. They go to the ER, get diagnosed with a severe herniated disc in their back and a small fracture to their right scapula. They prescribe pain meds and physical therapy. But no, they didn't want to do physical therapy. They wanted to go back to their chiropractor. At that point, everyone in the family, and I mean everyone, grandparents, aunts, uncles, cousins, etc., started pressuring them to go to physical therapy. Eventually they decided to go just to shut everyone up. Long story short, they spent a couple of months doing PT and they've never needed another adjustment again. Moral of the story is, talk to your doctor about back pain and go to physical therapy when they say you need it.